Welcome to Innovate for Impact, an informative mini-series brought to you by Tania Gomez Consulting. In this series, we embark on a journey to explore the remarkable innovations that are shaping the landscape of the NDIS for a more inclusive future. Join us as we uncover inspiring stories of visionary individuals, organisations and technologies that are revolutionising the way we approach disabilities.
So welcome to Innovate for Impact. Today I'm joined by River Knight from Developing Australian Communities. Thank you so much for joining me today.
Hey, thanks for having me.
It's really great to have you here. And I guess to begin with, I'd love a little bit of an introduction into yourself and your experience in the disability space, and then your political ambitions.
Well, I guess an introduction to me takes a while, but I'm one of those strange people that's jumped around in the disability sector for over 30 years. Started out as a teenager. I think one of my first jobs was working in a camp for kids with ADHD in Tasmania, which I thought was absolutely fantastic. I stayed up all night for 3 nights with these little kids bouncing around. It was great fun. The rest of the staff, I think, were completely stuffed by the end of it. But, I've worked from there, went into teaching, education, worked in youth detention here at the Brisbane Detention Centre at Waco with the kids out there. That was great fun. I went into forensics, disability community services as well. Special ed background originally, but then went into all sorts of other different things. Been on a bunch of national boards. I've worked with government as well, so child safety officer, public guardian, senior guardianship work, community visitor work, aged care. Been around a lot of different places, and of course the family came from a manufacturing background. I grew up going to the Hells Angels Christmas party every year down in Melbourne with the family, which was awesome. And I've kind of just been around that space of coming from sort of manufacturing, I guess, parents who are counsellors and educators and teachers, and then I went into that space, went into mental health, went into forensics, and it's just it's one of those sectors where there's just so many different things you can do, and I've tried to do pretty much all of them.
It sounds like you've had a very big variety of experiences.
It's been good, and I've never had a job. I think looking over it, it's been interesting. I've never had one employer. I've always had at least 2 or 3 different roles at any one time because the sector is so desperate, I think, for great staff. And I think it's one of those areas where you can really just find your feet.
And so where did Developing Australian Communities come into this?
Well, just over 4 years ago, I was looking at some of the events that go on in the sector, and I'd go to the expos and they would just suck. I'd go in there, I'd look at the pamphlets in the hall, and there'd be a little space, be nowhere to sit, and I didn't want to do anything, and they'd have a stage with someone talking to about 2 people. Whoever was stuck there in their wheelchair with the brakes on and while their carer ran away, you'd kind of get in there and you'd want to get out. And it was never a community feel, and what I really wanted to do was bring the community, together. So I'm a member of Queenslanders with Disability and People with Disability Australia, person living with disability myself. I wanted to create a community sense where everyone can kind of get together and fix the dramas that we have in the sector, because I don't think legislation fixes that. I think it needs to come from the ground up. So I really wanted to create these really cool community events where, kids can come and go feral and just run around and have fun all day, both days. So people come both days. And I just had this idea about, just creating these really cool, massive events. And I was talking to my business partner, Mike Clark, and I think that was at around November, December. And I just sort of said, look, I really want to just create some expos and events because I just don't like the ones that are around. And I kind of went around. I used to see him maybe once a month and do a bit of consultancy work with him. And by the time I saw him next, I'd already booked the hall at Brisbane Convention Centre and set up a website and sold a bunch of booze to pay for the website, pay for the halls and all the stuff that comes with an expo. And we did the biggest event in Queensland's history a few months later. And it's massive, and it's just grown from there.
So how many people do you have coming through the expos now?
Well, one of our recent ones in Perth, we had over 10,000.
Amazing.
So it's huge. Perth's probably the biggest event. Brisbane's probably our next biggest one. So we anywhere around 8,000 people. We've just had Melbourne, of course, recently. Melbourne's a little bit behind getting back into the feel of things, I think, with community events, because they just went through such a shocking experience with COVID.
Yeah.
And it's starting to pick up. But, again, we had, thousands and thousands of people in Melbourne. And of course, Sydney this year was huge as well. The previous year we had huge, massive weather, downpours. We had transport strikes and COVID all at the one time in Sydney. But we still managed to get about over 6,000 people through. So they're huge events, and they are the biggest events in history for our sector, really. So, and it's been really exciting having the advocacy groups, direct that. So they're events that are directed and delivered by people with disability for people with disability. And we just keep growing, and maybe one day we'll get some support from government or some sort of grants or funding or anything at all would be nice. But in the meantime, we get some great sponsors that just make it happen.
Yeah, sounds amazing. So why the pivot then into looking towards politics?
Well, I've been looking at the political side of things because I was chatting to Verna, a friend of mine who's established what's called Democracy First, which is a political party that's based on that, that middle ground. So that 80% of Australians that aren't necessarily represented, because we tend to see the far left and the far right and the extremists and, the Pauline Hanson types and the screaming on top of things about, everything needs to be done for the small number of people, and then the 80% that just, sit in the middle that are like, well, can we just have some sensible, bipartisan work where we come up with intelligent solutions? I find that's missing. And I think in the last 10 years, we've had legislation changes, we've had NDIS happen, we've had changes in child safety, small business law, we've had things with education, we've had a lot of dramas in that space, and of course state services drying up a lot with the change to NDIS, and the decisions being made that I'm seeing now are being made by career politicians that have not spent the last 10 years battling through this process with NDIS. And I want to make sure that there's people there voting on legislation, creating legislation transparently, where we actually do consult and do co-design, as opposed to people like myself in the sector who, if I don't know what's going on, then it's been really well hidden, just not knowing what on earth is going on. And I really think that the voice and the vote in that space at a federal level, it really needs to be done by people who are not career politicians, who understand the outcome of the legislation that's actually going to happen. And then what I really want to do is make sure that that majority voice, that sensible middle, and of course the people living with disability, those parents that I work with all over Australia, I want their voice to be heard in Parliament, and I want to be able to represent that. And I just don't think it's going to be done well by, political parties that are hard to tell the difference between. But also, maybe don't really represent and probably haven't actually experienced the consequences of their legislation, at their grassroots level.
So where do you see yourself going as far as politics go? What exactly are you running for, and who gets to vote for you? Well,
I'm, of course, looking after, the community in that seat of Blair over in Ipswich. We were a little bit of city, a little bit of country, so we experience both. We have the rural issues as well as the citywide issues. Education, infrastructure is a shocker. I live on 30 acres, 15 minutes from a major city, and I can't get a mobile phone signal or NBN to run a small business. In this day and age, we all go through a lot of stuff out there. The federal seat of Blair is an important one because Ipswich, we have some very low SES areas. We have major issues with the housing crisis, and of course there's no public housing stock. There's no options there for private rental unless you're working full time. And SDA, of course, funding with NDIS is only about up to 4 to 5% of NDIS recipients that actually get approved for it. So the 97% who don't get approved don't have a lot of options, and it's an interesting mix out there. And the federal election will be called, I guess, in the next couple of months, and we'll probably be seeing that mid next year. And I'm hoping I can get some votes from that majority that actually want to be heard.
Mm. And what happens next if you do win? What does that mean? How can you? What's your platform then that you can use to try and drive some of these changes?
Well, for me, the big thing that I don't see is the connection between the community that legislation affects and the legislation that gets changed. So for me, what I want to be able to do with that platform is make sure that we do actually co-design legislation with a community that it actually tends to, transfer onto. So if I'm looking at NDIS legislation, for example, we have great minds in all of the education spaces, as well as health, as well as mental health, that aren't being heard at a state level, that get affected by the federal government and the federal legislation. And when we have this argy-bargy between state and federal, the reality is that if you can't get NDIS, it's the state systems that then have to somehow find the funds and the services to respond to the needs that you have. So it needs to connect well. So one of the big things I really want to do is look at how we show the community that the connection between state legislation and federal legislation actually does work. And I want the sector to know what legislation is coming up. So I'd love to be proposing legislation around NDIS, around education, mental health, where we make it a mandate that case management is actually done in spaces like NDIS or around disability support, and get away from this, cookie cutter approach where we've taken professional roles in case management, where we've seen social workers and professionals in the disability sector who usually sit down with participants and say, I understand disability, I work in this space, I can see what you're talking about, let's come up with a plan that suits you. We've changed that now over the last 10 years to something where the government wants an administrator to be able to do that role with a tick and flick form. And that's a criminal approach in my perspective. I think that we need to mandate within legislation that professional knowledge is used, and that we have that case manager in there, because it avoids so many of the dramas that I see service providers going through as well as participants right now. And the next step for me will be very much to really review, what is the legislation missing out on? Is it far left, far right? Is it too extreme? And we've seen some interesting stuff here in Queensland right now. We've got a new government that's just popped in with the LNP. And of course, immediately we've got some really interesting legislation that they're trying to put through at a state level, looking at things like the adult crime, adult time rule. So we've got 10-year-olds now facing life in prison, which is a great example of a far left or a far right approach, as opposed to a sensible, intelligent middle. A 10-year-old that's done a crime that's worthy of a lifetime sentence. We're really missing the point, I think, by creating laws around something stupid like that. And I really want to get away from that for education, mental health, and of course, disability services.
So there's a lot in that, but if we look at NDIS specifically, there's a lot of suggested changes over the next couple of years. Things like looking at mandatory NDIS registration. They've talked about SIL and support coordinators and platform providers being registered from as early as July next year. We had a bit of a bomb drop this week with art therapists and music therapists no longer being funded under therapeutic supports and being moved to a participate community model, which is like, a quarter of the salaries or the price line they were receiving. There seems to be these thick and fast changes coming through where there's no real way that could have been done with co-design. And I'm wondering your views on, will we keep seeing these thick and fast changes all through next year, or will this potentially stop when the election comes through and there's a new government, or maybe a new government instated?
Well, I think the only way it stops is by getting people elected that are actually going to really value co-design. So when the entire sector, national advocates like myself, people like yourself, the national peak bodies for people with disability in Australia are surprised constantly by these changes, then co-design is not happening. Co-design is not being informed in a surprise way after the legislation's been put through. That's not co-design. That's informing. That's like me going to the wife, hey, I've bought new drapes for the lounge, and I've gotten green. And wasn't it great that we did that together? That's not how that works. You're supposed to ask in the first place, what's a great idea? How do we get budgets under control? How do we do things properly? Unless we get people in there that can say, hang on a sec, before you pass this legislation, do you know what this means? Do you know how this is going to affect? Is it going to do anything? We're not going to see that slow down. We're just going to see a big fight. And of course, art therapy is a great one because I know many people who do art therapy. I've been in that space myself, and they've spent decades trying to justify the work that they do. And the amazing impact it has on people with a disability, psychosocial cohorts, all that sort of thing. And again, the government has basically gone, that's basically finger painting, and we're gonna treat it like a fun activity you can do in a group. We're not going to pay professionals to do it. We're just going to cut that back. And again, they've taken away the point of it, which isn't just the art therapy. It's how do I engage someone? How do I get them out of my house? How do I get them more independent? How do I get them have relationships with other people? How do I engage them really well while doing all these other things? It's like when we talk about disability. When you take someone shopping, it's not about shopping. It's around learning money management, how to manage those spaces, how to plan, how to get my diet ready, and how do I plan my cooking at home, and who's going to be there, and do I live with other people, and how are we going to cook together, and how are we going to map budget, and how are we going to go up there and talk to people at the counter, and how to actually engage as a member of the community as opposed to someone who's following a staff member. Shopping's not about shopping. Art therapy is not just about art. It's about all the stuff that comes with it, and I think that's the stuff that we're seeing a real challenge in the space because we're not co-designing. And what we see is the legislation changes and the things that you're seeing at the moment, I find they're kind of like a misdirection. So, years ago when the LNP decided that they wanted to renew the legislation and cut back on the equipment that they were funding, all we heard of is let's not allow people to spend all of those billions of dollars on sex workers and prostitutes. Or yachts. That's what we heard in the media. And those that work in the sector know that that's complete rubbish. Like Bill Shorten said, that the years that he's been in there, he's had probably one person that's ever had anything remotely around sex workers paid by NDIS. But that's all we hear. So right now we're hearing tightening up of legislation around access to NDIS because in his words, we're putting participants first. And all of us in the sector are scratching our heads going, if you cut access to disability services, how is that putting participants first? So we're almost feeling gaslighted really at the moment, where people say, we are fixing things and making it better for the sector by cutting funding and making sure you have no access to it. No, we're not really sure how the states are actually going to manage this. So when we chop all these people off NDIS and we stop funding them, their needs don't stop. And like mental health services at the moment, unless you're standing on the precipice about to jump, it's really difficult to get proactive mental health services to support you. It's hard to get case management. You have a private psychiatrist, the state-based case management services and crisis care team with Queensland Health won't touch you. So you have to be in the most extreme situation. And what we're seeing at the moment is legislation, I think, to make Australia feel like maybe they're doing something. But the reality is it's the way that NDIS runs it that stuffs the budget, and we're not going to cut that budget down by doing things like let's change the funding model for art therapy. We're not spending $40 billion on art therapy. We're spending billions of dollars on people in one-on-one settings where we're going to push them into group homes, but we're not going to renew their plans properly. I've got friends who have got $500,000 a year packages. They haven't even spoken to a planner for 4 years. They just roll their plan over. And I've got friends who are starting to, just joke around with NDIS and email them saying, hey, why are you giving this money? I don't live there anymore, and you've got the wrong number, and that person's passed away and you're still funding them. I've seen people sending off these ridiculous messages to NDIS just to see if they get a reaction, and they don't. I've had service providers who can't get invoices paid who are doing the right thing, let alone hear about the rauders. I've had one service provider who didn't get an invoice paid for 8 months. They were owed $80,000. And they didn't get a response from the payments areas of NDIS until they sent an email with a picture of an alpaca saying, we've appointed Beavis the alpaca, the head of our collections agency. If we don't get a response for this invoice, Beavis will be coming to your office next week. And then they got an immediate response from the payment area going, oh, that was lovely. That really made our day. Thanks for sending that on. They're like, wow. So it's not that you don't see our emails, you're just ignoring them. So we've got good providers that are being destroyed and put into financial trouble, as well as all this talk about rauders. So I think what we're seeing at the moment is stuff to get headlines and to make the government or sort of, I guess, con Australia to think that maybe they're doing something. But those that work in the sector know that attacking art therapies are going to make a difference to the budget.
It's just political spin, really, isn't it? It's all just a message to put out there so that when providers kick back about these changes, they've already got a narrative in place. It seems to me that they are gaslighting in a way that they're like, oh, there's so many. Like I saw this terrible post that I think it was the NDIA posted a couple of weeks before they started to talk about deregistering or defunding, I suppose, support coordination. They sent out letters and emails to participants talking about the measures they were doing to stop dodgy support coordinators and plan managers right before they announced that they're looking to exit plan managers and support coordinators. So it's all like a narrative to put out there first, oh, support coordinators are terrible, they're taking all of this money. They're putting this narrative into the news so that over here they can be pulling back funds. At least that's how it seems to me.
And Australians as service providers and people living with disability aren't stupid.
No.
And that's the thing. So when we look at statistics and go, if you have really good advocacy and support, you get a better outcome when it looks at funding. If you have a really good support coordinator, people who have got good support coordination on average have better packages.
Absolutely.
Because they have someone who says to NDIS, so if you're 11 and you have a wheelchair, in a couple of years you're going to need a new one because your body grows, because kids grow. I know you might not say that on your piece of paper. It might not be on the tick and flick thing, but it's not rocket science to know that we're going to need another wheelchair for a kid. Yeah. It's not something that you need to do the black and white approach that we see with legislation, where we say, you know what, if I'm a kid lives in Brisbane here in the middle of the city, maybe I don't need gym equipment funded because I've got 4 gyms around me. But, if I live in the back of Whoop Whoop and I'm in a rural area, I've got no access to a physio. I can't see an OT unless I travel 200 kilometres. I've got no access to a gym. Maybe, gym equipment might be a great and reasonable and necessary part of my funded supports. But, of course, as soon as I do legislation that says we don't fund that, we are cutting out the ability to make intelligent decisions. And disability is based on intelligent decisions. The old system and what we saw in the first years of NDIS, you would sit down with a planner. Hopefully, they would be someone from the disability sector who knew how disability services worked. And they'd say, you've got a spinal injury, you've got this. Well, obviously, you're going to need this funding and that funding and that funding and that funding. And this is probably this is your wish list. I'm not sure if I can do all of that because we'd need this, this and this. But obviously, I have to fund catheters for people if they need catheters. I can't just stop that. I had a great story I saw online recently. One of the guys had their catheter funding just cut. No particular reason. They just decided that despite all the professional reports telling them that they needed it, the nursing staff, the incontinence professionals, the doctors saying it, OT saying it, besides everyone saying it, of course the administrator with their piece of paper said, look, even though I'm not a professional and qualified, my piece of paper says that you don't need that. So they cut that catheter funding. So this guy's been sitting there for the last 3 months going, well, it's running out, it's now gone. If anyone has ever tried to not go to the toilet, you don't last that long before your kidneys explode. And we've got people who are in life-threatening situations where they're like, there are non-negotiables when it comes to health care access, mental health, disability.
Is all of this just cost-cutting to save the budget?
Well, the things that we're seeing in terms of the action that's been taken isn't stuff that's really going to help the budget in a big way. So, art therapy, changing the cost that we can charge the hourly rates for art therapy isn't going to make a dent to $40 billion. When the politicians say we need to change the legislation so people can't hire sex workers, no one's actually done that. But let's change the legislation because that's going to somehow affect the $40 billion. That's not going to affect it. What we're seeing is, I think, a lack of action over the last 10 years, and we've seen a removal of professional knowledge. So if I go to child safety, for example, if I'm a CSO, I'm a worker in child safety, as a child safety officer, I have to have a degree in social work. I have to know how to work with people. I need to have professional judgment when I'm making decisions. I can't say, let's take that role and turn it into a bunch of pieces of paper that have tick and flick boxes and just get an admin person on $40-something thousand a year to replace the social worker. But what we've done in NDIS land is we've gotten rid of so many of those professionals that now when I talk to a planner, it's often someone who has no idea of disability. And they say the most offensive things to people with disability. I've had people say, well, we need evidence again that your lifelong disability that you needed to prove in the first place that you had to access NDIS in the first place, that you've still got it. And now we're seeing thousands of letters go out from NDIS to participants around Australia saying, we're reviewing everyone and we need all that evidence again to say that you still do have a lifelong disability, even though you have proven it before, and that cervical spine injury that stops you from walking and talking, that it hasn't miraculously been cured. And if you don't provide that in the next 14 days, you may lose funding. So we now have advocacy groups saying, well, could you at least give them 30 days? That'd be nice. If you're going to make them do it, give them enough time to do it, because for those Australians that have never had to go through it, make an appointment with a neurologist, a psychiatrist, a doctor, an OT to see you and write a big fat report to tell NDIS the same thing you've told them every year for the last 10 years. It takes more than 7 to 10 days. Yeah. It could be 30 to 40 days before you even get the appointment if you're not rich enough to have a private.
So I have a question about these time frames. It's really much been bothering me, all these time frames that I've seen coming out recently. So like the in and out list, I think it was 2 days notice for all these in and out items. Then we saw the art and music therapist. It came out and they on the Tuesday, and they had until the following Monday till the times had changed. The price guide comes out and it's effective almost immediately because it's delayed. How on earth can a government expect anybody to be able to actually comply with timeframes that are so short? Like, surely there is a fair and reasonable pub test that is applied to these things for anyone to comply. As you said, 7 days to get a report that's going to take you 3 months to get an appointment for. How when I've queried this before, people have said to me, well, the whole point is they don't want you to get that evidence. They're making it too hard. They're setting the bar too high to make it too hard for this to be achieved so that most people don't do it and they opt out, and it's kind of a way to force people out. Is that what you see, or do they actually expect that these timeframes are reasonable, or are they just living in another reality?
I think the decision makers are so far removed from that space. That's why we need to get rid of career politicians. I think we need to get people who are living in that space, because the cynic in me looks at that and says, well, if I create a system that's so hard to access that it's going to drive you completely bonkers that most people will give up, that's a great way for me to manage my budget. I've seen that with Centrelink. If anyone's ever tried to use Centrelink for services, they'll know, at that 50-minute mark when you're on hold on the phone to Centrelink,
that's the moment
most people will cut off, and that's a great way to get rid of the disability support pension. If I just say no to almost everyone that applies for the disability support pension the first time, then hopefully only some of them will come back and try again. That helps me with my budget. When we see consultation or information come out and you're given such a tiny time to respond, it's because they don't care what your response is. They've already decided they're doing it.
It sounds like it's by design then. It's not that they're far removed. It's actually by design so people opt out.
Well, the cynic in me certainly looks at it and thinks it's kind of hard not to interpret it that way. And I think that's the thing with Australians right now. They're not stupid. People with disabilities, their families, their kids, the voting public are not stupid. And when the government says, we're doing this to help everybody and we're cutting this system hugely and we're going to do it in a couple of days, and we'd love to hear your feedback about that in the next 2 hours. And, when we're going to do a whole talk, even when we see Mr. Shorten coming up doing some of his hall talks, which were lovely. I didn't get to go to some of them because some of them only gave me a couple of days notice that they were even happening. And I was like, oh, okay, it's on. I missed that one. But obviously, there were some people that turned up, but I can guarantee some of the ones that would have loved to have turned up there to have a good question, maybe they didn't know about it. And I think, the cynic in me wonders that, when NDIS rolled out and we saw hundreds of millions of dollars axed from the major advocacy services when it rolled out, the cynic in me says, well, if I'm going to do something that's a bit dodgy and I'm going to be totally disorganised about it, the first thing I want to do is get rid of the people that are going to hold me accountable. Yeah. So, it makes sense to cut funding to advocacy groups and make sure we don't replace that. And that's what we're seeing now with the state services.
Looks like it's by design then, right?
It does look like it is by design. And I tell you what, if I got elected and I got into the mix of things, one of the things I would love to do is just sit there and go, now the cynic in me wants to know how much of this was by design. And Australia, you already know. You can see it. It's not.
It's
not
either
hard.
by design or they're incompetent, right? And I'm not sure which is worse.
Well, the thing is, I'm not a big conspiracy theorist because if anyone's ever worked in government and you've met government bureaucrats, they're not good enough to do really complicated.
That's also what I think.
That's why I'm sure if I was elected and I went, you know what, I want the Roswell of Australia. I want to know if we've got aliens here in Australia. Is there a conspiracy? I can guarantee if there was a conspiracy around something like that, it wouldn't be secret because if anyone's worked with government, they know that they're absolutely hopeless at doing it. We've had all of our data for NDIS participants as well as Medicare breached, hacked and shared on the dark web multiple times over the last 10 years. So they're terrible at keeping secrets as well as security. So most of it, if you look at it, I think you can interpret it pretty straightforward. But it does look like by design. I think that's why Mr. Shorten has done what he's done in the last 12 months because he knows it needs to be a mic drop because there's no way in hell he's going to get re-elected after doing what he's done.
Yeah, I completely agree. And I think the timing of it all is very suspicious. And I also am not a conspiracy theorist at all, but just it seems just too timed as far as 10 years with very little intervention, then all of these reviews followed by very hasty action that couldn't be thought through at all in the speed that government usually works. And then for all of these successive blows, it really does seem like they're out for the sector. I see it from providers' perspectives because I've worked with providers since the rollout. And it really seems, from my perspective at least, that they don't want providers to succeed. And if you look at, I'm doing a PhD at the moment looking at success factors of small and medium businesses in government regulated spaces. I'm comparing RTOs who have been in government regulated sectors longer, and then what can we learn from them to help NDIS providers succeed. And when I'm doing this, I found a definition of what quality NDIS delivery was supposed to be, which was written when the scheme was being designed. And it actually says in there that the quality of NDIS supports relies on the quality of providers. But nowhere are we helping providers. It seems like we're just throwing more and more crap at providers every day and expecting them to fill the gaps.
Well, legislation and regulation doesn't equal quality. And as far as that's my perspective. So someone who's done aged care licensing, disability licensing, child safety licensing, all of that, regulation does not equal quality. I can buy the policies and procedures off the shelf to get approved as a service provider, and I can do a terrible job and still make money. So it doesn't deliver into quality. Legislation, for example, does not equal quality. If you look at the current legislation, because it has failed dismally and it continues to fail. You know, we've had restrictive practices legislation for decades, and I still have service providers. And when I used to audit service providers and government agencies with the community visitor program with guardianship, I used to go into government-run group homes, and their staff and management still didn't understand that they were using restrictive practices without authorisation. And these were government organisations. And then but we've had this around for decades. We've had restrictive practices legislation, guardianship administration legislation, and we still have service providers and professionals who have no idea. We had that big story in Melbourne with the uproar about, oh, how dare you, restrain a child. So those staff were restraining the child exactly how they'd been taught, how they'd been trained, how it had been approved. They were breaching the legislation that's been around for decades. But we have to get a news crew in there to shine a light on it for them to go, oh, what an uproar. Oh, what a shock. It happens every day. We've got people who are dying, getting bashed, raped, abused daily. And things like human rights, that the whole abuse, neglect, violence and exploitation can't wait another day. And we've had our Royal Commission, and unfortunately it's been shelved, and it seems to be sitting there with dust on it. And just like a lot of other Royal Commissions, I'm really worried that we're going to go through for another couple of years, and the government's going to say, oh, now it's a bit old and it's been a while. Probably can't do those recommendations anymore because they're not really current. We might have to do another Royal Commission and spend hundreds of millions of dollars on it. So unfortunately, that's the stuff that's scary for me, and that's the stuff I'd like to create a voice for in Parliament to say, I've got 222 recommendations from a Royal Commission. You've endorsed a handful of them. The rest of them you've gone, well, it sounds like a good idea. I'm not going to commit to it. If we don't talk about it, maybe everyone will forget about it and they won't hassle us too much. But, if we're looking at a to-do list, how are we going to fix the sector? Yeah, the NDIS review might be great. That'd be a good start. There's a whole bunch of recommendations there from Mr. Bonahady, who put a lot of passion and work into that. We've got our Royal Commission 222 recommendations. That'd be a great to-do list. A lot of those really crucial things that would make a difference to the people's lives, especially the safeguards, haven't even been touched. And when the Royal Commission says that even without NDIS funding, it costs the economy here in Australia, anywhere between $60 to $80 billion, the impact of violence, abuse, neglect and exploitation, just that in itself should motivate our decision makers to know, you know what, regardless of how we do things, I can't afford to spend $80 billion a year by doing nothing. Yeah. And when I see stats like, the majority of 11-year-olds living with a disability experience violence. Yeah. Because they have a disability. That should be the motivating factor. I'm not worried about art therapy when I'm looking at an $80 billion spend on children living with disability in our schools facing violence every day. And when it's the majority of those children, that's when it gets really scary.
There's so much to tackle there. There's so many issues within the government, but also if you just look at the tiny little section that is NDIS, how does the government, and I guess what would your platform or your approach be on where do you start with trying to tackle those issues?
Well, I think what we need to do with legislation, whether it's federal and state, I think we need to mandate in there that is not optional for these departments to work together. Education, child safety, family violence, youth justice, forensics, health, it has to be in there as law that if you have a client, a child, an adult, whatever that is across those spaces, you are mandated to work together, because that's what we see happen. Everyone sort of has a little silo of funding and says, that's disability. We're the Department of Health. We're not touching that because that's disability. Yep. Mental health says, no, that's behavioural. We don't do behavioural. We just do mental health. And we say, well, they're not happy. Then we have education going, well, we're education. We do special schools, but we don't do mental health. We can't do that. We don't have any resources around that. And maybe, homeschooling might be the option, we really got to mandate, I think, and make it a requirement where we say, if you have a young person or an adult in this situation, you have to work together. The court shouldn't have to have an adult with Down syndrome and a major intellectual disability front them for being prosecuted around something that they've done they have no capacity to understand in, and find out that none of these other departments are working together. Now it's within the Justice Department. We have no clue of then how to look at, well, what do I do with disabilities? Where was youth justice? Where was child safety? Where is all these things? We've got to mandate it. We've had that with child safety, for example. We have our legislation within child safety that says if you've got a young child who comes from a background where they're considered to be First Nations or Aboriginal, you're supposed to have a representative from that organisation in the room whenever you have case management. And I used to get in trouble when I was a child safety officer because I used to invite them. And my managers would say, oh, what are you doing that for? I'd say, because the law says that I have to have a representative from that First Nations organisation in the room anytime I have a case meeting about this child. I would love to see that be brought in as law at a federal and state level. It says if you've got a person with a disability, there's a way that you need to coordinate. Health has to coordinate with mental health, has to coordinate with education, has to coordinate with TAFE, has to coordinate with NDIS. And that's what we've missed by getting rid of our planning reviews. I used to love the planning reviews when we first started. When you'd sit down with them, I had planners come to participants' homes, they'd sit there with them. We'd have the OT, the other services, we'd have the SIL provider, the community programs, we'd have some of the therapy providers there, we'd have the parents, we'd have the participant, obviously, and we'd all sit there and go, yeah, what are we going to do? And the planner from NDIS could say, well, we gave you guys $30,000 for this thing and you didn't really use it, so do you really need it? And you could make intelligent decisions like, yeah, actually, that's not really something that's really working for this person. Let's do something different. Do you want to get some support in this area instead? Yeah, okay. We could actually make really intelligent case planning decisions. I would like to see that as part of our legislation, because that's where you save money. When you can say to someone, you know what, oh, I've got one-on-one funding. Well, how long do you need that for? Well, I only need it because I don't go to TAFE. Well, when you go to TAFE and you're in a school and they've got all these TAFE support staff there, do you need the one-on-one staff? Well, maybe I'll need it for the first 6 weeks. But once I get going and they get to know me, I can create informal supports as well within that space. And then maybe I can use less funding. But no, we only do funding plans for 12 months. So if we give you that one-on-one funding, you have to have it for the whole year. If you don't use it for the whole year, you get cut off. that takes the intelligent design out of it. Now, that's the thing that I want to bring back. And if I could do anything, I'd be pushing for state-based legislation to mandate that they have to coordinate together. If they have a planning meeting, they have to have the participant in the meeting.
Yeah.
They cannot do an NDIS review without speaking to the participant and the stakeholders. If that could be a law that we could bring into legislation, I think that would nip a lot of things in the bud.
I think there's a really good point there. And if you look at other countries in the world, such as the UK system, which we somewhat informed some of the NDIS principles, in the UK, it's one government department. It's like the equivalent of human services.
Yep.
And human services looks after children, education, social welfare, disability, because it's a human. You know, holistically, every human has needs, and we need to look at those needs holistically.
Tasmania is the only one that does it.
There you go.
I've worked down in Tasmania. I went down there for a few years. I got a few $1 million to set up this big child safety program. And the really cool thing I noticed, it was the only state in Australia I've worked in where there's the one major department that oversees health, education, child safety, all those spaces. So if you had an adult with a disability, their case manager, you'd go to that health department. The health department would go, well, disability, obviously, let's have a case manager who is a psych nurse because they have a psychiatric diagnosis. So the person they talk to that helps them with what funded services do you need, what funding do you get, what sort of things have you got going on in your life, was a psych nurse who knew what they were talking about, who could say, well, they need this, and they need this. I'm also listening to the participant, but the participant doesn't have to educate me in the basics of their life because I know that it's normal for someone to need support from a wheelchair if they have a major spinal injury. If someone has a psychiatric illness, maybe I can't just dump them into TAFE and expect them to succeed with zero supports in place. No, that would be stupid because I know what I'm talking about. But it was the only state that I ever worked in where they all seemed to talk to each other. You'd have health in the room, you'd have your nursing staff, you'd have your disability services, you'd have justice, youth justice working together, you'd have the adult forensic units working together, and as well as all the community services and organisations talking to each other, and that was normal. Whereas here in Queensland, I've seen over the last 30 years where we had our silo departments, the Department of Disability Services Queensland, and we had our health department, and we had mental health, and then we had forensics, and then they all chopped it up a little bit, and then, then they would argue again. And what I would love to do is just bring in that mandated law that just says, you know what, you have to talk to each other, and you cannot make a plan without those other people in the room, because if disability services, NDIS drops the ball on someone, they go to hospital. And then the hospital and the health system has to go, how do we manage to support this person who requires one-on-one nursing care? We haven't got any nurses. We haven't got any beds. They've got a home because NDIS has dropped the ball on it. Now they're in the hands of state-funded health services. And health services are going, well, how do we get them out? There's no housing. So now housing now has to be brought in. Guardianship needs to be brought in because the person may or may not have capacity. And then we've got all these problems and all these people going, well, we don't talk to each other, and if you get good staff who do a good thing, then you get a good outcome. But when you don't legislate it and say, law says that you need to plan. So you have to have NDIS, health, and everyone in that room for those meetings so that this person actually gets that wraparound person-centred care. Because what we're doing now, what I fear, is we're going backwards to the feed and water approach to funding. Well, we don't fund art therapy. Don't worry about that sort of stuff. They need their medication. We'll let them have 3 showers a week. They can have 2 incontinence pads a day. So my piece of paper says that you only need to poop twice a day. So I'm only going to give you 2 continence aids a day, and you have to try and stick to that. That's what we're going back to. And when I see that in planning meetings, and I talk to bureaucrats that are administration staff that have no professional capacity or background disability, that's what scares me. And I've had a friend recently that I was part of their planning review, and I had an administrator say to them, you don't qualify, you are only going to get funded for this number of adult support aids a day. And they said, well, what if I need more? No, you don't qualify for that. You'll need to get another reassessment, and you'll have to pay for that yourself. And they can't sit there and go, well, $40 billion budget, giving someone an extra support ad or a catheter a day just to look after them isn't going to make a dent in that. That's not where we want to focus. We need to focus on the intelligent design and get back to case management. And case management is something that I would really want to make law.
So a lot of what we talked about, things like the number of continence aids or art therapy as very broad examples, all of this, if we're saying that it is possible for a piece of paper to make those decisions and a bureaucrat with no experience to make those decisions now, then does that mean that the concept of choice and control is now evaporated inside the NDIS?
Well, we can say people have choice and control, but if you don't give them an avenue to exercise that, they don't have it. It's like putting someone in prison and saying, you have choice and control while you're here. We're going to lock you in this cell. No one can hear you yelling out for help. But, if someone did hear you, you could probably talk to them. And that's what I see. We push this thing back with NDIS onto choice and control, where they expect people to self-advocate all the time. And if you have a disability, a mental illness, an intellectual disability, you are the worst person in the world to advocate, because it's really, really hard to self-advocate when you're surrounded in a room with people with that power inconsistency. And that's the thing that I think has happened. You can say people have choice and control, but if I give you, a can of Pepsi and a can of Fanta and say, you have complete choice and control over what you drink today, here's two options. You've only got two options. So that means you have choice and control over the things I give you. It's like when I started teaching in grade 1. The kids felt like they had choice and control over what we did today. I gave them options for things that I was going to do that day. They had the impression that, we're going to choose this or we're going to choose that. That's not choice and control. That's me completely managing and coordinating that in to say, well, we could read this book or we could read that book. I'm not going to tell about this other thing that I don't want to do today, but I'm going to tell about the things I do want to do today. And I think that's where choice and control disappears very, very quickly. So if I put people in the room to consult and co-design who can't hear, that need an Auslan interpreter, and I don't have an Auslan interpreter that day, that person can have all the choice and control they like. They've got no idea what's going on in that room because they don't have a mode to then express that. And I think that's where choice and control gets eroded. If I don't have a planning meeting, I don't even bother to talk to the participant whose $400,000 plan that I'm managing. I don't talk to any of their stakeholders. I don't even have their name correct or their address because they moved 3 years ago and I forgot to tell anyone. If I don't do any of that and engage someone in any way, shape or form, which is what we now see happening with NDIS, how are they going to exercise choice and control? Because I've got friends who have got $400,000 or $500,000 a year packages, and they keep emailing NDIS each year going, can we please have a planning meeting so I can tell you what I want to do for the next 12 months? Because I may not need the funding that you've given me. I've got one lady that I know has been given a $30,000 behaviour support package every single year. She's never spent it because she doesn't have any restrictive practices. She never has any incidents. There's no behaviour support needs there. But every year, NDIS give her $30,000. So she engages a positive behaviour support service, which is lovely. He does training with staff. But she doesn't need that. But she's worried if I don't use it, they'll take it away and maybe I won't be able to do other things. But every year she asks for a review so she can ask them, why do you fund that? I don't need that. And if I go, well, here's $30,000 to $50,000 per package. If I have 600 and something thousand participants, if 100,000 of them had $30,000 to $50,000 a year that I was funding that they didn't need in the first place and don't want, that's a hell of a lot of money that would make a difference to the budget. And I don't want to take funds away from people where they need the funding. What I do see a lot of, though, is people going, well, I've got this funding, I'm going to have to find something to do with it. And I see that a lot. And then I see the poor mums and dads who have a young person with a disability barely getting anything whatsoever for early intervention therapies and supports, desperately crying out for support, can't even get funding for respite because they need a break, and NDIS just won't listen. And then I've got other people in the other extreme that have been funded and they don't even know why they've been funded. And I've even had participants recently who have been given other people's plans. And they're like, that's not my name. It's not my address. That funding is really weird, doesn't make any sense to me. And if you had an actual conversation with me, maybe I could exercise choice and control because you're asking me what I want. But again, you don't get choice and control if the person you're talking to is making the choices.
Yeah, it's true. So in a utopian vision, what would the NDIS how would you reshape the NDIS?
The way I would love to reshape it is to get away from these silo NDIS offices, and I would go back to good case management for people living with disability, so that we go to more of a social work model where we sit down with an adult or a child or a family, look at what their disability support needs are and what we need to fund and what services come from the state-based service, what come from federal. And then we also look at wrapping around, because it costs us a lot of money having a crisis approach. I would sit there and go, well, disability often doesn't happen in isolation. If I've got an adult or a child living with disability at home with mum and dad probably need support. Because if you have a child with a disability, you are almost guaranteed that that marriage is not going to last. It's a simple statistic. You are so much more likely to be parting ways. And the reality is the majority of the times that happens, it's mum that ends up with the kids. And so we don't just do case management for an individual with a disability. We need to sit down and go, right, this child or adult needs support services. What funded services do they need? What equipment do they need? What's the long-term plan? What's the early intervention plan? What does mum and dad need? You know, what things does this young person need support in terms of what are they going to do after school? We're just going to give them an extra 2 years of special school just to give them something to do before they go to a day program in a sweatshop, you know, or are we going to do something useful with them? You know, what are we going to do with the siblings? You know, siblings growing up in a space where you've got children with disabilities, they need some outlets. And I've seen some wonderful sibling programs when I was working with Autism Queensland. It wasn't about going, you know, you poor things having to deal with a brother or sister. It was like going, as a sibling, you know, someone needs to give you some attention too, because a lot of it's put onto, you know, the brother or sister who's growing up with a disability. So let's support the siblings as well. Let's look at youth justice. If I've got an intellectual disability, if I look at the forensic unit out here at Waco, if we look at the Forensic Disability Services Act, every single person currently locked up in the Forensic Disability Service here at Waco does not meet their criteria under the Forensic Disability Services Act. They belong in a mental health service, because under the Act, they're not supposed to have a mental health diagnosis as their primary diagnosis. And they all do, every single one of them. I used to work there, and that's how I know that. We need to lock that in and say, well, if I have a mental illness and a disability, I'm far more likely to need help around relationships and safe relationships. Maybe not sex workers, but safe relationships, because I'm so much more likely to be a victim of sexual assault. If I'm a woman with a disability, and I'm homeless, and I have a mental illness, I'm also far more likely to be a victim of domestic violence. If I'm in a group home and I haven't got a choice about who's in the group home I live in, I'm massively at risk of domestic violence. So I need to have the justice services as well. We got rid of that with child safety and the police service, where we used to be able to have local police services with a disability contact. And you'd have someone who'd be starting to get into trouble. You could talk to the local police. They'd have someone who knew something about disability come out and have a chat and help support with that casework. So what I want to do is get rid of these NDIS officers. I want to get back to social work, community services, where you look at all those different areas of a person's life, the family that they come from, the housing issues, all the stuff that goes in there, with the idea that we want people to pump out the other end successful. As opposed to, well, now that you've got NDIS, you're going to have NDIS for the rest of your life, and there's no escape from that, and you're never going to proceed beyond that. I want to sit there and go, well, how are we going to move beyond it? And you only sort of, I think, move beyond, develop those skills and have a really good life by good case management and actually having choice and control. And sometimes choice and control means you get to say things that people don't like.
Mm. So my last question for you today is around your competition in the seat you're running for. Have you done your due diligence on them, and are they a career politician?
Well, we've had Mr. Newman in there for quite a long time, a Labor candidate. I was trying to find some stuff that he's done. I haven't been able to dredge up a lot. Very much, been in politics for very, 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 very long time. Hasn't done much else, and that's what we've seen with a lot of those safe seats, where you've had someone whose job for more than 10 years has just simply been to be a politician. But unfortunately, I've also got an interesting seat there with the state election, where we've got a one maybe remaining Labor state candidate there. The rest of them all went to LNP. Last election, I think Labor managed to win with almost 30% of the vote. LNP won by about 28% of the vote, I think it was. So if only a third of your electorate votes for you, you're not representing the majority of people in that space. And I guess that's the thing that I really want to make a point of is the majority of unheard Australians don't have people representing them. And if it's a career politician that only has 30% of the vote for the entire region, they're not representing. And I think in a seat that I've been in, looking at the due diligence side of it, has been talking to the community about, well, what are the core issues in that space, and they're very unique. They're about, you know, the front of house staff, the industry that's in that space. And we're having that issue with all of the tariffs and stuff that we're talking about with the USA. You know, we're having issues with, you know, manufacturing in Australia. We just whittled away. We've got infrastructure problems there in Ipswich that are very much the same as some of the worst in Australia. And then we've got things like housing, which is a major issue. And of course, we've now got this crime bill that's being passed at a state level. And I can guarantee, working from child safety, I know that a very significant number of the young people in youth detention are from that region. And right now, I don't find that any of the current serving members, and of course any of the ones that ran previously, come from a background where they've actually spent time in the youth detention centre. And I worked in there for years. Kids were lovely in that space. It was the best teaching job I ever had. Never had a behavioural incident once in any of those classes, because in those spaces they were incredibly well resourced. They had really good teaching staff, they had really good youth work staff, they had good therapy programs. The kids couldn't take drugs because they couldn't access it. And we saw the same kids coming back and forward every single time from that Ipswich region, because when they were released and transitioned, they would have a 19 to 20-year-old social work student as their case manager who had no idea what they're talking about. He would do a transition plan, and I'd say to the kids on Friday afternoon, so, you know, do I put your stuff away? And they'd be like, no, I need to finish grade 10, so I'll make sure that by Monday I've done something to get back in so I can finish, which would really upset the social workers. And unfortunately, they were coming from a space where they didn't really have the life experience to represent, you know, what was really important. And I think looking at the current members, of course, for that federal seat of Blair, I just don't feel that there's anyone there that's spent enough time in the current situations and the dramas that we're having to be able to have a really good understanding or even an intelligent conversation with people where they can meet them on that level. And I think with NDIS, I think that's going to be a real challenge. If you're going to change legislation, change management with any organisation is a huge one. And I would definitely not be having a government department manage that. And I certainly wouldn't have someone, I don't feel comfortable having someone in a federal seat making votes on passing legislation that's going to affect people at a grassroots level who doesn't have that connection and of course and that face-to-face experience of going, what do you want me to vote? People of Ipswich, you know, what is actually important? Do you want me to support this bill? Yeah, and I think most politicians walking in a room and asking the community to tell them what they want and engaging them face-to-face would terrify most of our career politicians, and I think you'd be hard-pressed to see them. And we've seen that with NDIS. Bill Shorten, love him and hate him, he was the only federal member that turned up to big community events more than any other. Linda Reynolds, I couldn't get her to come to almost anything, would be petrified to come and front the community. The guy that came after him, I can't even remember his name now, he was so fleeting, military man, you know, couldn't get him to come to anything either. But of course, when I had Bill Shorten there, the one thing I did like about the way he did his engagement is he would turn up and walk through the crowd, and he'd be comfortable talking to people and going, tell me what's going on. And he'd have people really angry with him. But he would listen and go, yeah, tell me what it is. This is what's important. He was really good at that. I don't like what he's done with NDIS recently. And I think a lot of it's about him moving on and doing a bit of a mic drop because the powers that be have said that's what needs to happen. But I think when it comes to our federal elected members, you need people who are going to be able to go, so what's going to work? If I go to the service provider, the meetups, some of those are huge networking events that you run. If I walked into that room and said, hey guys, can you spend 10 minutes writing down 4 or 5 solutions to all of the absolute mess that we currently experience with NDIS, I can guarantee you I would walk away from a session like that with probably most of the solutions that I need on that piece of paper, because all of those minds in there that run organisations that deliver disability services, they are quite capable of telling you exactly what needs to fix up the budget, sort out the dramas, and also participant groups. Most participants will sit there and tell you what works and doesn't work, because none of them are asking for Rolexes.
That's true. Or yachts. What would be the one takeaway that you would want our listeners to take from our conversation today?
Well, I think the biggest takeaway right now is that we do have a federal election coming up. So, make sure you're voting intelligently. Make sure they're thinking, well, do the people that we're voting on, are they getting a good message? And what I would say is disability service providers and people living with disability are usually terrible at standing up and giving their opinions a voice. So I think hearing about us talking, about all these sort of different issues, what I would love people to take away is what they need to do right now is make it very clear to politicians, to service providers that are dodgy, to the other agencies that are in there, that they need to voice what's important to them, that they don't sit there and go, the legislation's changed, that sucks, oh, poor us. I want to see people, start really standing up for themselves. I want to see more of the service providers who, have got hundreds of millions of dollars, some of them, the big ones in this space. I want to see them standing up and stop being frightened to question and say, oh, we don't want to rock the boat because maybe NDIS will make our lives hard. I want to see those great minds, all those service providers are doing amazing things, start joining together and going, you know what, this isn't good enough. Hey, Bill Shorten, hey, whoever's going to get elected next. The solution is actually pretty easy. What you're doing is completely stupid. These are the things that need to be done, and we're not going to put up with it any longer. No, we're not going to sit there and wait 18 months to get paid an invoice that you should be able to pay and it's not controversial and no one's arguing with. That's not good enough. I think we need to get people to probably take away that it's really important right now to hold the people that are making these decisions accountable. And I would love to see a lot more young people, adults with disability, as well as service providers, really just, standing up and keeping everyone accountable around that space. Because I think the more you don't, the easier the target is. And I think people with disability, traditionally are good targets because it's hard to self-advocate with such a big power imbalance. So I'd like to get people to take away that they need to get together, join up all the advocacy groups and start really pushing back. Because if you've got over 4.5 million people in Australia living with disability, more than 50% of people over 65 living with disability, that's a big cohort. And every single one of them have family members. So there's at least 4 or 5 people around that person that are voting public. And I think that's the pushback, is that we are not victims to our politicians. They represent us. They work for us. And if they're making decisions that we know as a sector are the wrong decisions, I think we need to make sure we're pushing back.
Yeah, I agree. That's great advice. Thank you so much for joining me today. It's been awesome.
Thanks for having me.
Thank you for joining us on another enlightening episode of Innovate for Impact. Stay tuned for more thought-provoking conversations and innovative ideas that drive positive change within the NDIS space. Remember, together we're shaping a future where innovation and impact go hand in hand.